All right. Closed captioning. Yay. If you need closed captioning today, just go ahead and show captions. We should be good there. Oh, look at our numbers are going top speed. Wait, everybody loves the fear factor. And especially they love Nate Turner and the stable accounts. So there we go. And Margaret and Alaina. So, all right. We are at 2:02. Awesome. All right, I'm going to go ahead and just start with a little bit of housekeeping for everybody. First of all, this is Lisa Combs. I know I'm a little quieter, maybe a little bit of the edge off today. That's because I'm in the Columbus Metropolitan Library and I'm trying to be respectful of those people around me. But I am here. I'm from the Ohio Association of County Boards. And for those of you who are wanting CPDUs, just stay tuned and give us a couple days and you will get an email that says your CPDUs are ready to claim and there'll be an evaluation to complete and then you'll have them. So thanks for that. As far as this particular webinar, please know that any comments or if you want to say hi to anybody, go ahead and put it in the chat box. If you have a specific question regarding stable, you can put it in the Q&A. I see that somebody already has their hand raised. That's usually an accident. I really don't pay much attention to raised hands. So if you have a question, just put it in the Q&A and I will take care of that there. I'll be sharing the PowerPoint from the stable presentation as we get going a little bit farther in here. And that's really the only PowerPoint that you need. The rest is an intro and a summary. So, all right, well, on that note, I'm going to go ahead and just introduce Ann Tapia from the Department of DD. Hi, Ann. Good to have you here today. She has been amazing and is helping out with getting things going for the Fear Factor. And then I'm also want to introduce Christine Brown, who's here. Give a little parade wave, Christine Brown. We're glad to have you. She's been on our panel to help decide what kind of things we are going to talk about at all of our Fear Factors. And then we have some more guests, but I think we're going to hold up on introducing them in just a minute. What else are we supposed to say, Ann?
I can kick us off with today's episode. We are in this first piece of introductions and the context, and then we will pass it over to our guests on the overview of stable account information, and then we're going to wrap up with some next steps. We'll do some Q&A and figure out what you all want us to talk about moving forward. I just noticed those times are all wrong. So in case you're feeling like it is not 9 o'clock in the morning, you're right. It is not. It is 2 o'clock in the afternoon, and I'll fix that before we post it on the website. So we will get ourselves started with a poll. As Lisa said, we like to keep it casual, including by making mistakes, right? Right. So we're going to start off with a poll. We want to find out who's here in the audience today. If you would answer the poll that will be launched now. Your options include service and support administrator, other county board staff, not an SSA, a family member, a self-advocate, a provider, opportunities for Ohioans with disabilities, staff person, or a staff from the Ohio Department of Developmental Disabilities. So if you would share who you are.
Yay, we have 175, 182 people on today. You guys are doing great. It's a good show rate. All right. All right, I got 90% of the people, so I'm going to go ahead and end that poll, and I'll share it out so you all know who's in the room with you. So we've got 75% of the audience today is service and support administrators. Thanks for SSAs. 22% are other county board staff, not an SSA. And then thank you very much for those providers, folks from Opportunities for Ohioans with Disabilities and from the Department of DD, which we have 1% of here today. So thanks again for being here and taking our poll. That gives us good information of what audience we're hitting. All right.
We're going to move into the context of why we are here today. So Fear factor stands for facts, evaluate, action, and results. With the idea being that we recognize that sometimes what prevents people from moving into a community integrated employment setting are fears that are sometimes not facts. And so these sessions are designed to help bust those myths that exist and to address the fears head on and help move more people toward employment. So we appreciate you being here. We want to call out that there are previous sessions that have been recorded prior to today's session, because we ultimately want to make sure that people are getting the right information at the time that they need. So please check out the website, along with that companion document that includes a number of different resources. The topics we've covered so far include Social Security disability income, Medicaid, ticket to work, and Medicaid buy-in for workers with disabilities. And our most recent session was on reporting requirements. We want to give a big shout out to all of you all, our Fear Factor fans who keep coming back and telling us that you want more. We will keep doing it as long as you tell us that you want more. So thank you for being here today. At the end of the previous session, we heard you all tell us that the stable account updated information was what was most important to you all. And so we have today's session focused on that, but do want to just call out the last couple sessions that we did: Medicaid buy-in for workers with disabilities, the SSDI versus SSI, basic overview, and then reporting requirements, which was done in March. And the link is here for you to access all of those previous episodes. We're going to go ahead and launch a second poll focused on today's topic. So we just want to get a sense of where you are with the stable information before the session. So the question is, how much do you know about stable accounts prior to today? Your options include: I've never heard about stable accounts. I've heard about stable accounts, but I don't know much about it. I consider myself fairly knowledgeable about stable accounts, and I believe I know as much as the presenter about stable accounts, in which case we can't wait to have you join us. Lisa, are you having trouble?
Hold on.
Okay. All good.
I'm trying to
wait
find
for it.
poll.
Wait for it.
What did I do for that? Knowledge check. Who's here? I just made it. You'd think I could figure it out. Acronyms. I've got so many different polls in here, Ian. I swear I wonder if I didn't save it when I just typed it. If that's the case, it's going to be okay. Hold on. Oh, there we go. I got it. Okay.
There it is.
All right.
Thank you, Lisa.
Let's see how quick y'all can get in there. I am hoping that we've done stable. I don't know if it's been once or twice now, but I like how I'm seeing the barometer. At least almost everybody has heard of stable account. That's a good thing. We're doing well. All right. A few more people put your votes in there, and I will share the poll out. We're stuck at 86%, so maybe I'll just keep up 87. There you go. All right. 88. We're getting there. Oh, good. Somebody. Okay. All right. I'm going to go ahead and end the poll, and I will share the results. So let's see what everybody's feeling like coming in today. We've got two brave souls who are willing to say that they have never heard of stable accounts. So yay. We are so glad you're here today. You are in the right place. We also have 65% of the folks have heard of stable, but they feel like they don't know much about it. So you also are in the right place. 33% of the folks on the call do feel like they have a considerable amount of knowledge. So, but they're still back. I like that. And we have one really brave soul who says that she knows, or he knows, as much as Alaina and Nate and Margaret know. So, you know, I always tell, if you check that box, it is mandatory that you reach out to any of us and let us know, because maybe you can be a presenter on the next time. So, all right, I'm going to go ahead and stop sharing that. And let's see if we can increase your knowledge and decrease fear.
So with that, we will introduce our Fear Factor superstars who are here today to share about stable accounts. We have Nate Turner, who is the Advocacy Policy Specialist with the Ohio Department of Developmental Disabilities, Alaina Bowers with the State of Ohio's Treasurer's Office, and Margaret, I should have asked you how to say your last name. Forgive me.
Dramczyk.
That's all right. Dramczyk.
Dramczyk with the Lucas County Board of Developmental Disabilities, and Christine Brown, who is a clinical research assistant and self-advocate faculty at the Ohio State Nisonger Center, who will share some of her experiences using stable accounts.
Hey, Christine,
We-
while you're up here, can you tell me why you think it's important that we all learn about stable accounts?
It's important to learn about stable accounts because these accounts are very much a safety net for people with disabilities to put money on the side and not have fear of losing your Medicaid. I'll also share some other things later when I can.
Thanks, Christine.
Quick shout out to all the folks who helped make Fear Factor possible. So we have a list here. I won't read everybody's names off today, but you've seen many of these folks present our other topics, and they are our production crew behind the scenes helping to pull these off and make sure that we have some great topics and in an organized format for you all to receive it. With that, we will pass it over to our presenters.
All right, so we tested this earlier. I'm going to make sure that I can reshare this. Let me know if this works.
Great, Alaina.
Perfect. Okay. Awesome. So I'm here actually with we have an intern in the room. She's not on camera, but she's going to be sitting in on this. So I'm excited for that. But in addition to that, Margaret and Nate have been two people that have been so important in, obviously, you know, the Board of DD world, the advocacy world, but they are huge advocates for stable accounts. So we're so thankful for them. And we're actually going to be in person with Nate tomorrow in Columbus. We're doing a testimonial filming with him at the State Library tomorrow afternoon, and we'll be able to tell his story. So the program is always looking for great ways to showcase the importance of saving and empowering those within the disability community. So obviously Nate is somebody who's been there since day one. So we're really thankful for that. I want to start by saying that this program is certainly a crucial part of the whole picture to help an individual with a disability save and have a fulfilling life that they can count on, especially if they're on benefits and they know that they can save through stable accounts. So our program is designed to really help families and individuals know about these important pieces. And a lot of our outreach over the years has been with the Board of DD groups across the whole state. We've been with Lucas County in the past. I think our team and our public affairs team has been in contact with hopefully all of the Board of DDs in the last year and a half. But in addition to this presentation, if there's any individuals on this webinar that are interested in having our staff come in person and do an event or do a webinar specific to their team or to a family, like a resource event, a family fun event, we'll be there. We show up, we travel, I go all over the state. I love it. So please reach out to us if you're interested, because we know that this program is a really, really important piece of the whole picture to help an individual's life. So we'll go ahead and get started. The slide deck is here to kind of help guide through the big pieces of our program. I'm going to lean on Margaret and Nate for a few of these pieces as well. And then, of course, Christine and Nate have some great stories to tell. I'm hoping that the Q&A will be able to, I know a lot of the questions that might come up I'll answer throughout. So, of course, if there's any questions that I were not able to get to, please feel free to put that in the chat and we'll do our best to answer those. So I think the biggest fear about stable account is that, at least that we found, is that there is a lot of misinformation that's been out there over the years. It's a very young program. It's only about 8 to 9 years old. Stable account actually just celebrated its 8th anniversary this past weekend. We were the first state to launch the ABLE program across the country. But in general, the ABLE program, the ABLE community is relatively young in terms of what it's been able to provide. And we're hoping that in the next few years, the continued education, the continued advocacy is going to allow more families and individuals to learn about the program and be comfortable enough to open an account and know that it's a great way to protect your funds from losing your eligibility for benefits. I think the other fear around it is that anything that's attached to the government might be a little scary, especially because these are private accounts. Stable account, the treasurer's office, we do not actually have, this is your money. We don't put money into the account. This is an individual's money that they're contributing into. So I think that sometimes when people think that, oh, it's through the government, there is that kind of initial worry. Especially if you're on benefits, people that take the time to apply for benefits, get accepted for benefits, whether that's SSI or Medicaid, they know how crucial it is to be mindful of their spending and their savings. And so if you don't have a stable account, you have to be really mindful of where your money is going, especially if you're also seeking employment. So stable account is a way that you can protect your funds. You can put your funds into the account and still have a way to work. You can have other people contribute into that account as well. And that money is there, it's yours, it's there to grow. So we're hoping that this webinar is a way that we can just provide more education. There's been a few updates to the program that we're excited to share as well. And then in addition, our team is available for any training and education to any board across the state, any provider group. And we're just looking forward to continuing partnerships as we grow our program. So a little bit about what ABLE is and why this program is so important and why it's crucial for individuals who are on benefits to know what an ABLE account is. So as I mentioned, stable account is Ohio's ABLE program, and ABLE stands for Achieving a Better Life Experience. And that was a federal act that was passed in 2014. It took over 10 years of grassroots legislation for this act to pass. And the reason that this is so important is because if an individual is receiving SSI or Medicaid, there is a cap on how much money they can save each month, as we all know. So the ABLE Act allowed every single state to create their own ABLE program. And the ABLE program, ABLE account, is a savings and investment account that individuals can contribute into, and the money that is saved in that account can grow over time due to investments, or you can use that money on day-to-day expenses. Christine gave a great example when we started this, and she gave an example of how she's using her funds very specifically. I know we've met a lot of account holders that are able to save their money over time. Family members can create an account for their loved one at a young age, max out each year. And then by the time that their child is 18 and that transition period, they're going to have a lot of money in that account for them to rely on for a very long time. But we know a lot of account holders that use their stable account every single day for day-to-day expenses, which we'll talk about, of course. ABLE accounts across the country are very similar to another 529 program. So an ABLE account is a 529 plan. The other 529 plan is a college savings account. Also very similar to a checking account where you can deposit money into the account, take money out. And then the third product that we really, really advocate for as well, because they serve a great purpose, are special needs trust. So special needs trusts are set up privately through an attorney group. Those attorneys are really, really well-versed in the probate court process, guardianship, legal guardianship, estate planning, and they know relatively what stable account is. We've been able to connect with some great attorneys across the state of Ohio that really advocate for our program. And both of the products can be used very well together, which we'll talk about at the end as well. So moving a little bit away from ABLE to stable, as I mentioned, stable is Ohio's ABLE plan. We are a national plan, and we just surpassed 40,000 accounts since launching in 2016. I'm going to skip a slide here. We have account holders in every single state because we were the first state to launch an ABLE program, and those that were following the ABLE Act were really excited to open their account and start saving. We have 450 million account under management, which is a lot of money and that means that all those account holders have been able to save more than that $2,000 limit if they were receiving SSI. We lowered our fees this past January, making us the national program with the lowest fees. So we were able to put back into the program as well. And then on the operational side, our back end is always looking at ways to update the experience for an account holder. We are proud that we're very accessible. The portal is very accessible. If you call customer service and have questions about language, or you're hard of hearing, or you need assistance, our customer service team is really great at assisting each call with the best care. We also are making sure that security on the accounts have been updated as well. We updated our two-factor authentication process, and we also want to make sure that those that are managing accounts for individuals also have the best experience managing the account as well. The benefits of stable accounts are the ownership, the self-esteem, and the financial independence. So a lot of our account holders, Christine, Nate, Kyle pictured here, they're able to have the account themselves in their name. They've been able to open the account themselves, and whether or not they had someone along the way help them, or let's say mom and dad opened the account when they were younger. We know a lot of account holders that are able to manage the account completely themselves. And if they're working, they can also put their paycheck in their account, which is really empowering for them. But it also allows families to have that peace of mind as well. So a lot of families will open the account for their loved one, their child, and they will put money into the account. And then by the time that their child is 18 years old, that child might be able to manage the account themselves, or they might have someone else assist with the management of their account, which we'll talk about as well. It also eliminates the spend down, increases the amount of short-term and long-term savings as well. So if you're receiving SSI currently, you're not allowed to have more than $2,000 at any time per month. So it's allowing you to be able to save more if you're putting that extra funds into the stable account. So it really empowers those individuals to start thinking about long-term goals, whether it's saving for an opportunity to live independently, or you're saving for a vacation, or if you're working and putting partial, of your paycheck into the stable account, that money is the beneficiaries, that money is there to help that person's life. Our team is always on the road. We've been able to attend some great opportunities across the state of Ohio. We were just at a national conference in Pittsburgh a few weeks ago, and we learned a lot about the Able Age Act, as well as other ways that we can promote our program through legislative work as well. So our team is very connected to the disability advocacy groups across the whole country, and how other ABLE programs are working together to promote the ABLE program, but also be mindful of any legislative work that's going on in the country that might affect the disability world in general. So our team is proud to be part of that. And we're always looking at ways to make sure that the account holder is well-versed in what's going on with the ABLE community as well. We are really proud, as mentioned, of our testimonial storytelling. We're always looking at ways to tell the story of account holders, because I think that really shows how people are able to save their money in different scenarios, different demographics, different ages as well. We want to make sure that every person that's eligible for a stable account has the opportunity to learn about it, educate themselves, and make the decision to open the account in the best way that they can. Another great update that we did this year was our direct deposit partnerships. So we've been able to connect with a lot of groups across the state to empower those that have a stable account to use direct deposit into their account. So there's a lot of great organizations across the state that are working towards employing those that are disabled. And then also there's a lot of great opportunities for parents or guardians to be able to put their paycheck into their loved one's stable account as well through our new direct deposit update. So we're proud of that as well. So eligibility for a stable account, and this is for all ABLE programs across the country. First, the individual living with the disability must have had the diagnosis or disorder occur before they turn 26. So you do not have to be below 26 to open an account. We have account holders that are well into their 50s and their 60s because they were born or they were diagnosed with a disability. Plus, if that disability also allows them to be eligible to receive SSI or SSDI due to that disability. Our program doesn't require you to send in anything in terms of your disability, but if you're currently receiving SSI or if you're on Medicaid, then you are eligible to have a stable account. We have a lot of account holders that are not on benefits, but they have a stable account for whatever reason they choose. And a lot of parents will open a stable account for their child and they're not on benefits at the moment, but down the road, they feel that their child might be receiving those benefits. So it's important to have the account set up if you are on those benefits. We do have an eligibility quiz on our website. So if you're ever working with a family, or if you have an individual that's receiving services, feel free to go to our website and take a look at that eligibility quiz, because there is information and links to the Social Security Administration, just because they do have a lot of information about those different conditions and what it means to be eligible for benefits. As I'm sure all of you know much about that, but we do like to mention that to families as well. Our website is the only place that you can open an account. So we do have a paper process. And I wanted to make a really important note about this, because Margaret and I we kind of talked back and forth about the enrollment process. And we want to make sure that any provider, any group, any parent that's working towards opening an account, they understand the process of enrollment. So we do encourage families to go to stableaccount.com. If you do the online enrollment, it takes less than 15 minutes, which we're very proud of. That's part of our user experience that we're always looking to update. The enrollment is going to ask you, if you are opening the account for your child, they're going to ask you questions about not only the beneficiary, which would be the child, but yourself as well. So those questions to verify your identity are very similar to other financial institutions. They're going to ask for the Social Security number. They're going to ask about addresses, date of birth. They're going to confirm that they're able to look up that information. A lot of times, though, some people don't have history that they can look up. And we want to make sure that if that happens, you can always call our customer service line while you're doing the enrollment online. They can pull up exactly what you're looking at, and they can walk you through the enrollment process as well. If for some reason you fail the enrollment process, if they can't verify your identity, you will receive an email about it, but you can always call our customer service line and just let them know this is what's going on. So I know that Margaret is well-versed in this, and if there's anything you wanted to add to that, Margaret, feel free. I actually lost the chat. The chat keeps popping up, but I can't get to it. So I don't know if I need to take a break and go through the chat, but let me know if there's anything you want me to add about that, Margaret.
Sure. Thanks, Alaina. No, wonderful information. I think my main experience has been, unfortunately, it's with individuals who just don't have a lot of support, and they don't know a lot about their own past. And so it is very challenging when that is the situation. Fortunately for those who do have support, it's not a barrier at all. But once that does happen, they do have to go through, as Alaina mentioned, that paper process. Yeah, that's my main comment. Nathan, would you like to add?
I would agree that I think that is one of the hardest parts or barriers face, is going through the enrollment process when they might have a thin credit file or might struggle to remember some aspects of the identity verification questions. And so I don't know if, Alaina, do you have any feedback from customer service about ways they can do that better, or is there some type of like a document that might explain the enrollment process so that people know what to bring in advance of applying for the account?
I think that sometimes what happens is if you fail the identification process, they do require you to mail in documentation. So if you do have a driver's license or documentation that you live at a residence, that could be the way that they can verify you. But of course, if somebody doesn't have access to that, or if they're kind of walking into the enrollment process without any support, I know that that can, be a little intimidating. But if you call our customer service line while you're on the enrollment page online, or even if you print out the paper enrollment forms and you're looking at the forms, they are pretty lengthy. But if you're looking at the forms and you have a question about an area in that, our customer service is the best place that they can be able to walk you through what is required. I know that the paper enrollment process does take a lot longer than the 15 minutes online enrollments. And that can be a little frustrating to mail things in and wait and kind of see where you're at in the process. But we have a working relationship with our account manager at Bestwell. We connect with them on a daily basis. And so if there's any time that you're a provider and you're, meeting with a family and they've mailed in their forms and it's been weeks, please reach out to me directly and I can and call Bestwell and see where it's at in the process of verification. Just so that we can make sure that there's no delay and open the account as well. So I know Margaret and I have done that before, and I know that it can be frustrating if it does take some time, but we just want to make sure that people are able to use our customer service line the best way.
Looks like Christine, did you want to say something?
Yes, I want to say something that's going into effect because this is in section 124 of the federal code, a modification to age requirement for qualified able program. This thing where they're going to change the age onset from 26 or younger to 46 or younger goes into effect effective for taxable years beginning after December 31st, 2025. So that means starting in 2026, anyone who has the disability 46 or younger is when that is supposed to change. Just to let everybody know, we'll give update then, but I wanted to point that out because that got done in the Secure Act 2.0 at the federal level.
Christine with the facts. She beat me to it. I appreciate that, Christine. That's a big one. That was something that I think I mentioned that we had talked about at the national conference with ABLE programs. But that is something that has been in the works for a long time. And when the ABLE Act was passed, everyone thought, okay, this is great, but why is there the 26 put into place? And our operations manager can talk all about the tax code and requirements and what it would put back into the federal program. But now that has been changed, it's obviously going to open our outreach to a lot of different areas, especially disabled veterans and those that were disabled after they turned 26, or maybe they got a late diagnosis, or we want to make sure that is something that we are promoting even before it becomes legal. So I appreciate you bringing that up, Christine, because that's a huge one.
Yes, because the thing is, I even know somebody who got on a disability at 26 in a car accident, but all because it was after 26 he couldn't do it. And it's like, then this person that I knew of served in the military. So it's like, you serve in the military, you're serving America, but then you don't get to do this. So I just wanted to point that out because I see it here, and thought you'd want to know that.
I appreciate that. Thank you so much. That is a huge one. And people that are also disabled veterans, their benefits are very different than how SSI is administered and Medicaid as well. Their benefits look a little bit differently than other benefits, but they still obviously, deserve to have the opportunity to rely on an account that is protected and that they can save as well. So we're excited to do outreach for that and to find areas and groups in Ohio that could really benefit from that. So we also launched in April 2024, we launched an incentive program. So it does require you to put in $25 to open a stable account. But if you're an Ohioan, once you deposit that $25, minimum $25 or more, once you deposit that initial $25, you will receive a $25 match. So this is the way that we're able to put back into the program. This is obviously a new incentive. A lot of programs do incentive, you know, if you open an account by June, you get $100 or those types of things. So those are kind of funded through grants in different ways, but I think that this is a really great way that encourages account holders to think about opening an account. I'm going to get to the fee page, but that $25 actually covers an entire year's worth of fees plus more, which we'll talk about. So $25 is something that I think is enough that could really help somebody, especially if they're looking at the $25 minimum opening deposit and they're, you know, not wanting to do that at the time. This is going to be the way that we can put back into the program. So enrollment can be done by the individual with the disability. So the account holder, the beneficiary on the account is always the person that is eligible for the stable account. So a lot of our account holders are very independent. The account is, they have their login, they can go to our website, they manage the account completely themselves. In a lot of cases, that individual with the disability may need support along the way. So our system has it set up where an authorized legal representative can also open a stable account on behalf of the individual with the disability. This is just a quick list of what those could look like. You know, parents, legal guardian, spouse, sibling, Social Security rep payee. And we've done a lot of restructuring on our site and our process of having authorized legal representatives be able to manage accounts, just because we see a lot of account holders who are a little bit older in age and they might be in a residential home setting, or if they don't have someone to support them, then they might have a rep payee, or if they're in a provider home or a group home, they're going to still need access to their own funds in a way. So if they have an established stable account and they move into a residential home or a group home setting, an ICF setting, that organization can actually act as the ALR for them. So we've seen a lot of change over time with this. I know that when stable account was launched, it was all about the individual and the family opening the account for them and the family being excited to do this. But the other side of this is that a lot of those you know, individuals will eventually be independent and they'll be kind of on their own. And so we want to make sure that there's always going to be support for those individuals to be able to still have someone to help them and take care of them. And there's a lot of great groups across the state that actually are working towards setting themselves up to be an organizational ALR. So it simplifies the process if they're overseeing more than one account. Our record keeping in the portal allows like one login and they can manage and see multiple accounts as well. And they're authorized, so they're appointed by the beneficiary able account owner. So I know that that can get a little sensitive at times if somebody is unable to authorize, but a lot of times if someone is the guardian and they're court-ordered appointed, they're a court-ordered appointed guardian, then they do have they're able to manage the account for that individual. A power of attorney is executed by the beneficiary. And then the guardian, appointment of the organization as guardian or conservator for the beneficiary and their property as well. So we do have information on our website about organizational ALRs. We want to ensure that those groups that are taking care of individuals have an understanding of, number one, what is stable account and why this is important. But as soon as that individual is under their care, they can actually open an account on behalf of that individual and manage their funds that way. And I might take a little break to see if there's any questions so far, or I can keep going as well. I cannot, for some reason, I keep seeing questions come in, but I can't access it for some reason without losing without getting out.
Alaina, I messed up something at the beginning, so it might have been me. I'm sorry, but
Oh, it's okay.
I don't think I think we've been getting answers to some questions.
There's
as we
one
go through.
question. If a payee assists someone to open a stable, well, somebody just dismissed it or
Hi.
answered it.
I just answered it.
Sorry.
For that. That's okay. That's okay. I was kind of monitoring the Q&A as Lisa suggested. So I believe I answered that one.
Okay, wonderful. Thank you.
Should be able to hover over the top of your screen to be able to get your options. Do you see like a little zoom bar coming
do.
down.
Yes, now it is showing up. Thank you.
There you go.
Okay.
You're
There we
welcome.
go.
All righty. Let me go back to this. Okay, so once the account is established, there's a few different ways you can put money into the account. So as I mentioned, the individual that has the account, if they open the account themselves, they can obviously fund the account in different ways, but anyone can make contributions to a stable account. So if my daughter has a stable account and I'm working for the treasurer of state, I can actually have part of my paycheck go through the direct deposit portal and go right into her stable account. If there's someone that has a stable account and they're working, obviously we're really promoting the direct deposit piece because that ties so much into employment as well. But you also can transfer funds from a checking account, a savings account, and set it up just like you would transfer in your normal bank account through the EFT. You can mail in a check and our vendor will deposit it into your account as well. Employment is a really great topic. We learned a lot about this at the conference because there is so much new information and new awareness of individuals with disabilities seeking employment and being able to work and protect their funds. And I know that if individuals are on benefits and if they're seeking employment, previously there was, restrictions on how many hours they could work, how much money they could work. If they're, if they're receiving SSI each month and they were also working, there's kind of a table of different amounts that might go up and down. And I've seen the tables, and our program tries to educate ourselves as much as possible when it comes to the kind of the external rules surrounding employment. But we just tell people that if you have a stable account and you are also seeking employment, you absolutely can work and should put your paycheck in the stable account because that is the best way to protect those funds. The Social Security Administration does not look at those funds in the account and think, oh, you have, $10,000. You're making too much money, we're going to restrict your SSI or you're going to lose your eligibility for those benefits. That's why ABLE accounts were created. That's why the ABLE Act was passed. It was to give those individuals a different opportunity to be able to save and be part of the community and protect their funds. So it really does empower those individuals to seek employment opportunities, whether it's part-time, whether it's full-time. And we really want to make sure that those organizations across the state that are employing those also know about stable account, because there's a lot of rules that they, I think in the past felt that they had to abide by if they were employing those that were on benefits. And so we just want to make sure that we're still finding ways to educate those groups as well. This is what the direct deposit slip looks like. So it's very simple. You would actually go to your online stable account portal and print this off and then give it to your HR person, and then they would deposit it the right way. So very simple process. Especially if employers around Ohio are wanting to be able to kind of do like a mass direct deposit for stable accounts, this is another way that they can do it and see how efficient it is as well. For 2024, the amounts did go up for all ABLE accounts. So if you open a stable account tomorrow, you can max out the account at $18,000. That is the general contribution amount. So if you go into your stable account portal, it'll actually show you where you're at in the contribution so that you're not at the point of, it'll basically reject if you go over that $18,000. But if you are working, you can max out that $18,000 and then make additional contributions of $14,580. So that makes the account annually $32,580, which is amazing. If you have a stable account and you're maxing out each year, in 5 years, in 10 years, that's a lot of money. That's a lot of money that's been able to be saved, especially if you're also working part-time or full-time or seasonally as well, and also receiving benefits. Actually, I think we're going to get to the slide about SSI, which I'm going to hold. But also with direct deposit, we also have a gifting page. So if somebody wanted to, let's say my daughter's graduating and, grandma wants to give her $1,000 for graduation, instead of cash, she can actually gift it into her stable account. So that gifting, if you're maxing out that $18,000 and it's 100% gift from somebody else, that money in the stable account does not count as a resource or income if there's any concern about SSI.
Alaina, could I just jump in really quick with one comment that
Absolutely.
I
Yes.
always like to bring up in our presentations here in Lucas County, as well as with families. The one thing that I feel is important for individuals to know about the annual deposit limits. So it's not like a regular checking account in that you can deposit and withdraw all the time, all year long. It is a hard limit of deposit. So if somebody were to put in that money and then spend it all out, they have to wait till that first of the next calendar year to deposit again. And that is, it's not like our normal bricks and mortar checking accounts. We're used to just kind of moving our money around as our life unfolds. So that is a very, very important thing. That is a hard deposit limit.
Yes. Yep. And the system, once you log in your portal, there is like a bar graph that shows where you're at for contributions for the year. So it does reset, as you mentioned, and that is good to know. And obviously if you, don't max out that 18,000 in 2024, it's not like you can go in 2025 and make up for that time if you have a bigger check or something like that. It is specific to that year. Those are the general contribution amounts for the year. And they do go up a little bit each year. And I do have a little slide about the Able to Work Act as well, because that is crucial for individuals who are employed as well, being able to save additional funds. So the Sable account is an investment account. I'm not going to talk a lot about this. I don't give investment advice, but we do encourage families and individuals to learn a little bit more about how the investments are set up through our website as well. I know that financial education and financial awareness is kind of more talked about now, especially in schools. But I know that when you're opening an account like this, you're sort of, okay, what does all this mean? That's what I thought when I started with the program. I was like, I don't really know. I'm looking at these graphs. I don't really know numbers. I know what investments are, but I, definitely had to learn a little bit. And we want to make sure that individuals who are looking at this account when they're making deposits, that they're not intimidated by what this account could be. So in general, when you open the Sable account and you make your first contribution, if you don't choose from the investment options, it's going to default into the bank safe option, which is just a general savings account. It's getting a pretty good return right now, but the Able accounts across the country are also investment accounts as well. So when you do make deposits, you can choose from 4 Vanguard mutual funds as well, from aggressive to conservative. You can disperse your funds based on how they're set up. And then every time you make contributions, I believe you can choose 3 different ways each year in terms of how to make deposits. I think that's how it's set up. But in general, I'd say about 75% of our account holders have their funds in the bank safe option. So we do encourage families and individuals to learn a little bit more about that on our website as well. We've done some outreach to financial planners across the state of Ohio who are doing, estate planning, guardianship planning. And so they're the ones that are going to know a little bit more about what this account looks like. But if you're just choosing the bank safe option, it is in general a typical savings account, which is great. All right. The biggest question that I think we all get and people are concerned about is, what are you allowed to use your funds on? All Able programs abide by a term called qualified disability expenses, and that must relate to the disability and help maintain or improve health, independence, or quality of life. So these are just some big icons of what that means. If you're saving your money over time, or if you're working 4 days a week and you're putting your paycheck on your Sable account, you should be able to spend that money the way that you need to spend it on what's going to improve your health, your independence, and the quality of your life. So we know a lot of stories of individuals who've been able to save for transportation, or they've been able to save for a vacation, or they're able to put it back into education. I mentioned earlier that the 529 college savings plan is a very similar product. And if you actually have an established 529 college savings plan and your child is unable to go to college, or if education is not the best route for them and they qualify for a Sable account, you can actually roll those funds over into the Sable account. And then those funds can be used on things that are not just education base. So that's great. So we've heard a lot of great stories from account holders over the years of how they're able to use their funds to help their life. But obviously the biggest thing is just basic living expenses, housing, groceries, Amazon, deliveries, Uber, but also things that improve mental health, like vacations and being with friends. My uncle Bill lives in a group home setting in Columbus with the organization Boundless. And I know that they go on, they spend quality time together outside of the home, and they go on, kind of some field trips. And I know that his stable account is used to pay for the big things, but I imagine that they're able to also use his funds for those types of expenses as well. So it's a really great way, as I mentioned earlier, that when people set these accounts up, it's really important to look at long-term. How do you save? What are you saving for? But we know a lot of individuals that are able to use their account on day-to-day expenses. And that is through our Visa card. So our Visa card is an optional asset to the program. There's no fee with the Visa card. It's loadable. So if you have $20,000 in your stable account and you want to transfer $500 to your Visa card because you have $400 worth of expenses for July, then that money on the Visa card is just the money that's there that you've transferred. It's basically a sale of the assets, if you will. So the money on the Visa card can be used at Target, at Cedar Point. You can pay your AEP bill online with it. So we've heard a lot of great stories of the way that people are able to really use their funds in a more independent way. But you also can make payments through a check. You can transfer funds out from the account into, a separate checking or savings account at Huntington or PNC. We do encourage individuals, especially organizations, if they're managing multiple accounts, to keep track of spending. This program is this program is overseen by the IRS. And so at any time, obviously, any financial product, any account can be audited. We haven't had anybody in our program ever reach out to us and say, hey, I'm being audited, I need my records. But of course, the funds in the account should be focused on a qualified disability expense. So if you have a Visa card, that's the best way you can track expenses. You obviously can get your statements. But if you are transferring $1,000 out of your account into a checking account at PNC, obviously there's record of that transfer, but it might be important to keep record and receipt of those expenses. You don't have to send in anything to our program to say, hey, my rent's due next month. This is why I need to pay for it. It's your money. It's the way that you should spend it. But of course, be mindful of where those expenses are being spent. I mentioned earlier, special needs trusts are another great tool that can be used with the stable accounts. Special needs trusts are a really unique product. They're great. They obviously cost amount of money to be set up and managed. And there's some different rules in terms of how you can use those funds. But in general, if a family sets up a special needs trust for their child and they have kind of a long-term plan of what that trust is going to be used for, they can actually take money out of the trust and put it into a stable account. And then the funds in the stable account can be used more frequently on those qualified disability expenses. So as I mentioned, there's some great attorneys across the state of Ohio that really promote stable account as well as special needs trust, because they are two different products. And obviously we do encourage families to learn a little bit more about what a special needs trust looks like and how it's administered and established as well. All right, this is the important stuff. This is what Margaret sent me. So this is about benefits. As I mentioned, our program really tries to stay educated on anything related to benefits, because obviously if somebody is opening a stable account and they're on benefits and they want to make sure that their benefits are protected, as well as being able to have a stable account that they can rely on as well. So this is just some important information that Margaret was able to send to me, just because I know that there's been some misinformation over the years about what a stable account is and what can be deposited directly into that account and still have protection as well. So income saved from the following sources is still counted as income for means tested benefit programs like SSI, even when deposited directly into an ABLE account. So these are a list of those. I think the important thing is that income and earnings always need to be reported monthly to Social Security when you're receiving SSI. So if you have a stable account and you're also receiving SSI and you are working part-time and you're putting your paycheck directly into your stable account, you also can put your SSI funds into the stable account as well. But once you put your stable account funds, once you put your SSI funds in the stable account, they're no longer SSI funds, they are technically stable account funds. So I think there's been some misinformation about being allowed to do that. And we do encourage individuals to also put their SSI funds into their stable account as well. I know the next slide is some information more about SSDI, but before we go to that, if there's anything you wanted to add, Margaret or Nate, surrounding the benefits side of being on benefits and having a stable account as well, I would welcome that because I know you both are so well versed in this. So.
Absolutely, Alaina. Thank you so much. One of the most important things I would encourage people to do, if they have a job offer or any interest in working at all, please don't be afraid to pursue a job or go to work because something may happen to your SSI or your Social Security or Medicaid. There are work incentives in place to protect Medicaid eligibility, and even though SSI or Social Security income may go away as a result of working, people are almost always further ahead when they work in the community versus just living on benefits alone. And I think for SSI recipients, it is really important to keep in mind the $100,000 threshold with the stable accounts. And I think there are strategies to maybe use the stable debit Visa card in order to stay under that $100,000 limit and also provide some tracking information to keep track of where the money is spent.
Thank you, Nate. Yes. So if you are, I thought, I thought I had a little tidbit about this, but, if you're receiving SSI and your stable account over the years, obviously this is going to take some years to grow with contributions, but and we actually have had this happen, if your stable account exceeds $100,000, SSI has the right to pause your SSI because they don't terminate it, they just pause it because a lot of times individuals might be able to spend a large chunk of that money, making the $100,000 go down a little bit, and their benefits would be reinstated. So that is the one, I guess, contribution cap that we do like to mention. Obviously, if your stable account has close to $100,000 in it, that's incredible. That is truly an accomplishment. But I know that individuals, especially if you've taken the time and you rely on benefits for whatever reason it is based on your needs, obviously it's important to know that you can rely on those benefits. But that is the one rule that SSI, the Social Security Administration, has when it comes to contribution caps as well. So thank you for mentioning that, Nate. And then any other additional information about SSDI as well? I know that is administered a little bit differently than SSI. Income is not means tested. It is a benefit that is paid into by someone's work activity, parent, guardian, or the individual with that disability. So anything else that might be added to this? I know that sometimes people that are on SSDI are thinking that they're not able to be eligible for a stable account. So that is obviously something that it is the eligibility piece. If you're receiving SSDI, you could be eligible for a stable account as well.
I can say to you that I receive SSDI in 2 ways, and I have a stable account, and there's no concern about it. Just to share.
Awesome. Thank you. And I just realized, are we at time at 3 o'clock?
No, we have till 3:30 for this one.
Okay, awesome.
Thanks.
We're almost to the end and then we're gonna get to questions. All All right, so let's see, Medicaid. Perfect. Okay, so a lot of our account holders, if they're on Medicaid, really anybody that is receiving Medicaid in the state of Ohio, they are made aware of the Medicaid clawback payback process. And so that obviously happens when that individual passes away. I feel that every state has their own Medicaid rules. There's actually a few states that have passed legislation that Medicaid clawback cannot touch an ABLE account. Ohio is not quite there yet, but there are early talks about possible ways that we could protect account holders' funds from Medicaid, the Medicaid clawback process. But in general, if someone has a stable account and that account holder passes away, the account then goes to the account holder's estate, just like any other asset or financial product, bank account, house. The estate administrator will notify our customer service and then can take over that account access. So if my daughter passes away and she has a stable account, I would go through the normal probate court process to basically have access to her estate if I didn't already have access to her estate, being her guardian or her mother if she was over the age of 18. But in general, this is sort of the normal process with any type of situation where an account holder does pass away. Medicaid comes in if the individual was on Medicaid. So if an individual has a stable account for 5 years and the last year of their life, they were receiving Medicaid services, Medicaid has a right to only look at the services that were paid for that full year, not the duration of the 5 years of a stable account being in existence. But the program, the stable account program, has a ton of protections put into place before Medicaid can touch the money. So if my daughter is receiving Medicaid services for that 1 year and she passes away, I can go into her account as the estate holder and pay for outstanding bills. I can take care of the estate. I can pay for things. I can also pay for funeral and burial expenses, hospice situations, medical bills. I can make those payments. And whatever is left over, that is what Medicaid could look at just for the year that she was receiving services. And Medicaid can put a claim on the estate for up to a year. They have up to a year to make a claim on that case. Medicaid clawback is not specific, just a stable account, is for everything. And again, we are not associated with Ohio Medicaid. I know that this is a topic that a lot of providers and groups are aware of. And so we just want to mention this just because I know that misinformation has could potentially prevent a family from opening an account. They think, oh, well, when I pass away, all of it goes back to the state. And we've heard that many, many times. And so we want to be quick to say, well, not necessarily. There's a lot of protections. And we just know that that is important for families to know about. So that's why it's important to know about the Medicaid process, but also to know that if you do have a stable account currently in existence, you can take those funds and protect them in a special needs trust as well. Those are set up, as I mentioned, differently. There's different rules with tax laws and the probate court process. But if an individual is receiving Medicaid, then they might be subject to that payback recovery. And then we did, as I mentioned, we did lower our fees for 2024. So Ohio residents pay $15 per year. It's charged to the account quarterly. And then other states are listed here because we do have account holders in every state. So we are the lowest fee-based program in the whole country, which is awesome. And then asset-based fees are listed on the right-hand side as well. So very minimal costs for opening a stable account. And then our website is a great resource to find testimonial stories that we've recorded. We have a great 2-minute animated video right on our homepage that we did last summer with our intern. And we're always posting resources and FAQs as well. So we just want to make sure that any provider that has other additional questions, they can find that and reference that as well. But as I mentioned earlier, we are really excited and proud to just continue the partnerships, continue the education. this is a young program, as I said, and I think that there's a lot of families that have been like, oh, I've heard of ABLE, but what does that have to do with stable? What's the difference? And so when we're out in the field and we're able to connect directly with families, it's a great way that we can encourage them to answer, ask any questions and just give them that peace of mind. But on a more provider side, on a more resource agency, government side, we just want to continue to be a resource for all of you, because I know that you are the ones that are interacting every day with different families and individuals, and you know a lot about benefits. And so we want to make sure that we can be part of the whole process. And we're always looking at ways to promote and educate, even in the school district system, working with IEP, working with transition coordinators, working with medical groups who are working and seeing and overseeing and helping children. This is just a really crucial piece of the whole puzzle that's going to make someone's life better. And if someone's on benefits, we want to make sure that they know that this is a way that they can save a lot more money than they've ever been able to before. So I'd love to get to some questions at the end of this. But I also want to encourage Margaret and Nate, if there's any other tidbits, topics that I missed that you feel would be great to add. You both have been so amazing at promoting this program and helping families in your area. So I'd love to open the floor to both of you as well.
Yes, I would like to just add a couple comments that are overall comments that, what really excites me about the program is the idea that people who never before could build wealth in the traditional way now have a great and wonderful way to build wealth. And those words, never used to get used much with people who live with disabilities, right? So now we can talk about building wealth. We can talk about the child born with a disability can have this account upon birth. And that just really excites me beyond anything else about it.
Absolutely, Margaret. I totally agree. As you know, in my advocacy for stable accounts and able accounts nationally, I have an expression that money means freedom for the disability community. And I really think when implemented properly and combined with some other regulatory changes, we're going to, look back over time and realize that the able account legislation was as impactful as the Americans with Disabilities Act in terms of helping the disability community to build and ensure its own prosperity and get around the limits that were set by the federal benefit programs.
Yes, absolutely. Thank you both. There was a story that I wanted to tell, and I cannot believe that I passed over this, but obviously all of us are working in, the disability community in some way. So we're devoting our careers to this. We're passionate about this. And I think that disability looks very different in 2024. A lot of individuals are qualifying for benefits based on cognitive disabilities or mental disorders, or, they're seeking assistance and help in different ways. And so I think it's just all about how can we support these individuals? What do they need that's going to make their lives better? And I think the root of it is financial help, financial stability. And so one of the stories that I love, and this just picture makes me super happy, is this is Kyle McKay and Carrie Jones. They're from the Down Syndrome Association of Central Ohio, and he is their staff photographer. So he's the guy that is always with the group. He's out taking pictures. He came up to me and took my picture, and I didn't know who he was. And then he gave me his business card, and I was like, oh, this is how you get business. And then I looked at it, and he was like, I have a stable account. And he told me a little bit more about how he's able to use his account for different things. But most importantly, he's proud that it's his money and it's his business. And he's not only with DSACO, but he's an entrepreneur as well, because he's a photographer. He owns his business, has a Facebook. I know I'm plugging his business right now, but he's just a great individual that's really proud of everything that he's been able to accomplish. And so when I see stories like this, it does make me realize that there's just so many individuals out there that could really benefit from this program that haven't heard about it. And we don't want to we don't want any family to lose out on the opportunity to save their money if they're on those benefits, because that $2,000 each month, that's really hard to live off of. And especially if you're someone that is able to work and wanting to work, and be part of the community, we should encourage those individuals to seek those opportunities. So, I know that there's a lot of individuals that have stable accounts because they're able to open the account themselves, but there's a lot of individuals that are always going to need support and someone to help them as well. So I think it's just educating everybody that's part of this world, part of this process. And so our outreach to organizational ALRs is improving. We want to make sure that they're equipped as well, but on more of your community, anything that we can do to help with this process, coming in and doing a training, a webinar, even just having a day, like we're going to be in Columbiana County on I think it's July 16th. We're going to be there all day. We're going to be meeting with SSA team, and then we're going to be meeting with families later on in the day. So it's going to be like stable palooza the whole day. So we're hoping that that'll really generate some families to take the time to meet with us and walk through the process with us and make sure that they're equipped with everything that's related to stable accounts. So I just want to thank for the opportunity. Thank you for the opportunity. Our Ainsley, our intern, is awkwardly on side of me. I can't see her, but she's waving and she says hi. And our program.
Hello, Ainsley.
Nate, you'll meet her tomorrow when we do our.
I'm looking forward to it.
So thank you so much. And I guess I will open this to questions. Margaret, Nate, feel free to pop in on any other last minute.
I think I have a question that I'll ask on. I know this is predominantly an audience of SSAs, and I get a ton of questions about the role of the circle of support and the SSA's responsibility in that circle of support and how they might help a person to access and utilize the stable account website and make or change around allocations or distribute funds and that type of thing. I don't know if Lisa, do you want to talk a little bit about suggestions or things you're hearing?
I'm sorry, Nate, did you say Lisa? I should talk about that?
If you want to. I don't want to put any pressure on you. I just know that it's come up.
Yeah, it has. We have quite a few questions in the Q&A that I'd like to get to.
Okay, those might be better.
I think the biggest thing is that sharing information about this or walking through the website with a person is certainly within the role of an SSA. I mean, Nate and Margaret and I all, we sat there and tried to brainstorm some ideas, and there certainly is a line, but making sure that families and people who you're working with know about this and they know where the website is and they know how to, facilitating them to, call while you're sitting next to them and talk to stable folks on there. Any of that stuff is definitely more of a linkage and referral, and that's super important in our job. So I think that's the safe answer. I do love some of the things that Alaina talked about, that they're starting to look at other like organizational I can't remember what word you used, Alaina, but the authorized rep could be an organization type thing also. And so I think there's some exciting movement in that area that maybe we could get more people helping with the actual ongoing maintenance of it. I do want to get to a couple of these questions, though. I think a lot of people have upvoted the very first question, and that was, can you guys, any of you, give an example of what a non-qualified expense might be? I know it's pretty broad as far as qualified expenses, but do we have any examples of non-qualified?
I could try.
I could say something for an example because somebody has said this before, okay? So I'm just being honest. Like, can I buy money to get wine? No, you can't for that. I'll say that as an example.
Yeah, we usually try not to give specific examples, but the biggest thing that we say is if you have a stable account and let's say, your friend has a GoFundMe or you're at an event and you have the opportunity to make a donation to, the Ronald McDonald House or something. Obviously, donations are great and they're positive, but the money in the stable account must be spent on the person with a disability. it's the same, you know, kind of the same role, especially if an organization is managing multiple stable accounts, or if somebody is, you know, legally, you know, managing someone's estate. They should not be using the stable account funds on themselves either. And so we just want to make sure that that's sort of like the standard, is that the expenses should be spent on the individual with the disability, the beneficiary on the account. If you, for some reason, are audited and you have to pull your statements, you could be subject to a fine just for that specific transaction. I think that I've heard, you know, gambling is not something that is considered a qualified disability expense as well. I haven't heard too much about, you know, alcohol or other recreational things, but obviously something that is, you know, illegal, which shouldn't, you know, I shouldn't even say that, but those are kind of the more common things that we've said. But we just say that, you know, if you're really wondering, okay, is this going to improve my life? Is this helping my quality of life, my independence? And the answer to that is yes, then you should be able to spend it that way.
Good answer, Alaina. I was gonna say if it's illegal, don't do it. That's the safest answer.
I
I'm
think
sure there's-
in our case, our general advice to individuals is if you want to spend it on what I would call legal but adult activities. So those things we're all allowed to do, right? We're all allowed to have alcohol or smoke cigarettes or go to the casino. Spend other money. Just, you know, put that money aside in a different way. Therefore, you're not going to ever be at risk of the IRS wondering what you spent it on.
Perfect.
Yeah, it's a great answer.
Okay. The next question that a couple people wanted to know, and we may be able to give partial answers to these, I understand. But if an individual has been given benefits from a parent who has passed away, can the person on SSDI put the money into a stable account?
So if I'm understanding that, if somebody is receiving SSDI, can they open a stable account? Is that what the question was?
I think it's that they inherit money, I would imagine. I don't
If
know.
they
maybe
get
not.
the money from the parent's record, can that money be put in the stable account?
Okay, yeah, you're right. That is the question, Christine.
I believe so, but I
believe
can't
so. Yes.
Yes.
give the 100%.
Yes. Just like you can put SSI funds into the stable account, and the way that you receive SSDI funds, you could put SSDI funds in the stable account as well.
Yeah, as long as you meet the criteria for a stable account. Yes.
You know,
Yes.
I might add that if the individual who asked that is concerned about resource limits, because SSDI is not means tested, it's a different, again, it's a different rule. So if there's an inheritance, more what you would be looking at would be the amount of the inheritance versus the annual income, or I'm sorry, contribution caps that we mentioned. So if somebody inherits, like, for example, $50,000 and they're on SSDI, they can't put all 50 in a calendar year. So there would have to be some, you know, financial planning with attorneys or some financial folks that would be able to help. If somebody has nothing in a stable account and inherits 17,000 and would like to have all that money go in stable, they can do that. But that would be more what you would be looking at. It would be the amount of money and how much you might have in a stable account and what those limits are in any given calendar year.
Thanks, Margaret. And this
Thank
one,
you.
I know, I don't know the answer to this because it's about another kind of benefit. So when do people need to use a qualified income trust versus a stable account? Do we have anybody experts on qualified income trusts?
I
I'm
can-
certainly not an
go ahead.
expert. I mean, I would say, so any entity can contribute in that $18,000 bucket. So if a person would have less than $18,000 that they would need to, you know, secure as a resource in the stable account, they can do that. If it's more than $18,000, then maybe they would develop a qualified income trust.
Let me add to that a little bit. So for that individual who asked that question, a qualified income trust is specific to Medicaid waivers. It is a way that a person with a high amount of income needs to work so they can keep their DD waiver. So that is very specific to Medicaid. It is not the same thing as a special needs trust. It's a different kind of trust. My advice is to reach out to your Medicaid staff in your respective counties, and they should be able to walk you through why a qualified income trust is needed, if that is the case. But just keep in mind, it's very specific to Medicaid and to waivers.
Another question came in that says, what if the payee was listed as the authorized rep on the stable account when the original account was established? Can a rep be removed and a new added in the scenario where a person changes payees?
Yes, we have, and the same process with, basically that would be an ALR. So the change of whether it's an organizational ALR. So if someone's in the care of an organization and that organization, like Boundless, for example, my uncle Bill lives there. If he were to move homes, he would move his stable account to the new home, and an organization would have to go through the change of ALR form. And then the previous organization ALR would have to sign off on the transfer, and then the organizational ALR would go through the process of obtaining access to that new account. So it's the same with the change of a general ALR, which I think it's just ALR. I'm going to go back to that page. So if somebody is in the care of a Social Security rep payee, that rep payee can be considered somebody to open an account on behalf of that individual. And if they change payees, they would have to obtain a rep payee change form, or the rep payee change form would have to be basically filled out and authorized by the rep payee. The previous one or the current one would have to sign off on it. And we've seen, I just want to mention this because I know that this is something that came up recently with our conference, is that sometimes when there's a new rep payee that is established or they come in, they were instructed to send all of the stable account funds or any SSI funds that are in a stable account back to the Social Security Administration. Our program does not encourage that, because if you're putting SSI funds into a stable account and there's a change of rep payee and their new rep payee comes in and they're being told to send the money back, you're not sending SSI funds back, you're sending stable account funds back. So we want to encourage those new rep payees to not really do anything with the stable account until they have full access. But I do encourage the new rep payees to learn a little bit more about what the ALR form and the change of ALR process looks like as well.
Great, thank you. So we have a question: when using the stable card, certain transactions are blocked for various reasons. Can you change the settings?
Yes. So usually if something is blocked, it means that there was a protection put in place. So like if I gave my daughter the Visa card and said, you can use this, but you can't use it at Amazon, I could actually go in the back end and limit expenses paid to certain merchants, or like, you can only spend $50 in the in the month of June. So if there's protections put in place, they're like toggles on the back end. So someone would have to go in and like toggle or put in certain protections. So if there's expenses that are being declined, it's probably because somebody went in there and set it up that way. I think that's probably what happened. Or you were trying to use it where Visa's not accepted, or possibly use it at an ATM. I know they don't necessarily work at it. You can't like get cash out. That would be my understanding with that.
Also, Alaina, wouldn't it be because it is a preload card? If the person doesn't have enough on there, it could also decline.
Yes. Yep. So basically the way that the account's set up is that if you're putting $200 on the loadable Visa card, it takes about 3 to 5 days for those funds to appear on the card, because you're essentially doing a sale of the funds in your investment account. So once the funds are on the Visa card, only $200 can be spent from it. So the system will reject any expenses that are trying to be used. It's not a normal Visa card like through a checking account. It's not directly linked to the stable account either.
Okay, last question. Where do we send paper applications?
Paper applications. So if you go to stableaccount.com, at the bottom, there is our address that you would send it to. It's a PO box. Also, if you print out you go to our website, the enrollment page, there's a PDF you can download. It's the paper enrollment forms. On the forms, it has many times the address that you can mail it to. So it's a PO box that's not affiliated with the Ohio Treasurer's Office in Columbus. But I don't have the address off the top of my head, but I do know that's on the paper forms on our website as well.
Thank you for directing people there. With that, I think we will go ahead and wrap up. We are going to launch one more poll. We would love to know what you all want us to talk about next time. So as Lisa is launching the poll, I don't know, do you need Alaina to stop screen share? Nope. Okay, it worked. So the topics that we have available are Medicaid buy-in for workers with disabilities, the work incentives for older adults or workability group. How does work impact housing, transportation, and food assistance? Make sense of all these resources, or perhaps you have another idea, and if that's the case, please feel free to drop that in the chat, whatever other idea you may have.
And apologies for those of you who, I'm sorry if an email said this was going to be over at 3, but the recording will be available. So if any of your friends jumped off, or you want to go back and look at it, we will definitely have that recording available to watch the last 30 minutes. And they always are an hour and a half. I'm not quite sure how that happened. So, all right, we got 75% of our results in. So I'm going to go ahead and share back. It looks like it's pretty much all over the place as usual. We've got Medicaid buy-in is always a hot topic. That came in first, and Christine will be excited for that. Lots of changes coming up in that one. Also just kind of make sense of all the resources. We all need to hear this over and over again. It's very confusing. So it sounds like anything that will help us make sense is good. And then I'm glad that some of you are wondering about how does work impact housing, transportation, and food assistance, because we haven't done that one yet. So that would be a good one to look at also.
One more thing I'd like to point out, because we've had a question of it and people have had the message wrong, okay, is a stable account counted as an asset for your Section 8 housing, and it's not supposed to be. So if anyone ever has questions related to that, you can contact the benefits consultant and they could tell you. But I know somebody who thought their Section 8 housing people thought a stable account was counted as an asset, and it's not supposed to be. So I wanted to point that out because it wasn't mentioned.
And in the specifically in the county board and the waiver system, I think it's important that we recently did get some guidance that sometimes some of our waiver services, we're supposed to look at if the person has their own resources to provide that, especially in the world of like assistive tech and participant directed goods and services, those kind of things. And we did hear from the Department of DD that stable accounts are not to be considered in a person's direct resources to purchase those things. So again, not that they couldn't, they certainly can if they want to, and if that's something, it might be easier for them. But as a county board and as SSAs, we should not be asking for what's your balance in your stable account, or that could be used for, out of your stable account before accessing a waiver service. Only they're checking, more direct.
Stable is always supposed to supplement other resources that are already available. It's not meant to replace them or intended to replace them. But if somebody so chooses, they can.
Take a moment to thank our excellent presenters today. You all have shared so much information that I think it'll be helpful to know we have this recorded to go back and review again. So thank you for everything you have shared today. Stay tuned, attendees, for our next episode. Based on your feedback, we will get that coordinated and send out details about what that next Fear Factor episode will look like.
Thanks
Thank
to
you.
Thank you all.
I put my email in the chat too, if there's anybody that needs follow-up, or you guys can share it too. Thank you so much. I appreciate it. Thank you, Margaret.
Perfect. Thank you.
Thank you.
Appreciate it. Thank you.